Welcome to the Sharkpreneur podcast with Kevin Harrington and Seth Greene. Kevin Harrington is the inventor of the infomercial, one of the original sharks from the hit TV show Shark Tank, and has generated over $5 billion in TV and digital direct response sales. Seth Greene is the world's first trusted authority on cutting-edge direct response marketing, a best-selling author, and the only 3-time Marketer of the Year nominee. On the podcast, Kevin and Seth interview Sharkpreneurs who share straight talk on what it takes to explode your business.
Why do so many businesses struggle while others seem to explode overnight? Do you wish you had the secret to this type of exponential growth? Now, I've scaled more than 20 businesses to over $100 million, and it's not just luck. In my new book with Mark Tim, Mentor to Millions, you'll learn the repeatable framework I use in all my business ventures for massive success. Order at kevinmentor.com and get over $1,000 in bonuses. Head to kevinmentor.com.
Welcome to the Sharkpreneur podcast. This is your co-host, Seth Greene. With me, as always, the inventor of the infomercial and the original shark on the hits TV series Shark Tank, Kevin Harrington. Kevin, thanks so much for being here.
Great to be here, Seth. Excited about our special guest today. Looking forward to it.
Yes, today we are talking to Dr. Reid Maclellan, founder and CEO of Cortina and adjunct professor of surgery at Harvard Medical School. Doc, thanks so much for joining us.
Thank you, Seth. Thanks, Kevin. Good to see you.
Good having you with us here today. And I'd love for the folks that are listening, Doctor, how about maybe tell us a little bit about yourself and how you got into the business that you're in now.
Sure. So I'm actually a surgeon by training. Did my medical school down in Alabama at UAB, and then I did all of my postdoc training up at Boston at Harvard. While I was up at Harvard, I actually was afforded the opportunity to get a postdoctoral master's degree in medical science from the business school and the med school combined. And the title of the degree is literally commercializing medicine. So fast forward a little bit through my training, I get recruited to actually join faculty at Harvard Medical School's plastic surgery department, as well as Boston Children's. So I focus strictly on birth defects at the Boston Children's Hospital. Did that full time for 3 years, but I knew there was something else out there. I knew there was something bigger than me. After my postdoc degree, I realized that I had always been an entrepreneur. Yes, I'm also a physician and a surgeon, but I'm an entrepreneur. And so I went to my chairman and let him know, unfortunately, I got to leave. I got to create my own company. And so that was kind of the birth of Cortina.
So tell us a little bit about what is Cortina and what are you doing that is literally changing the game?
Sure. Cortina is a virtual dermatology practice. It is a teledermatology that is currently available in all 50 states. When I say teledermatology, what I mean is that we actually pair each of our patients with one of our board certified dermatologists. We only work with dermatologists because those are the individuals that have by far trained the longest. They've seen everything out there, and they can truly create personalized medications. So we have our own compounding pharmacy. So once the doctor sees the patient, they submit back to the patient, here's what I think you have. Here's the treatment plan for you. We send that directly to our compounding pharmacy. It's made on site and shipped out. The doctor actually sees the patient and and diagnoses them within under 24 hours. One of the many reasons that I actually went forward with creating Cortina was because the average wait time in Middle America can be anywhere between 30 days to up to 6 months to be seen in person. Not all skin diseases can be treated virtually, but a lot can. So we wanted to provide everyone in America the opportunity to have access to truly elite board certified dermatologists at the end of the day.
That is absolutely incredible. I mean, I've had that issue where you call to make an appointment with my own dermatologist and it's 3 to 6 months to get in. I'm like, can I just send you a picture? And they're like, yeah, we have an app now. So I send a picture and like, this is what you got. And they send out, but I mean, they're just prescribing regular stuff. They're not compounding it. They're not making it themselves. It sounds like you've got a better class of physicians providing a truly customized experience that normally we wouldn't even be able to get.
Well, you're absolutely right. And I'm not saying that your dermatologist is not a great dermatologist. The difference is actually that any dermatologist can write a compounded medication. But when we talk about pharmacies, 95% of pharmacies out there are retail pharmacies, which can only fill the prescription that are generic or trademarked. So we're thinking of CVS, Walgreens, Walmart. And since 95% are that way, that is one reason. The other reason, just quite frankly, normally compound pharmacies are expensive. So if you tried to truly personalize, it would cost you as a patient would not actually want to pay for it, because most of the time, unfortunately, health insurance, pharmacy insurance doesn't cover and doesn't reimburse. So you're paying out of pocket. So what we've been able to do is actually create a tremendous cost savings that we pass directly on to the patient. And at the end of the day, you're right. The generic prescription, it will work to a certain extent, but not all skin is the same. The real reason that we created Cortina, to be quite honest, my wife and I were in Cortina, Italy on our honeymoon. Here's an entrepreneur that I am and my wife is. We're thinking about creating a new business while we're on our honeymoon. So really, for the first time ever, my wife had this glowing skin. I like to think it's because we were on our honeymoon. She doesn't. She thinks that it was actually because of Cortina and the Southern Alps that were up in, the air, the water, everything together. And so she said, Reid, if we could figure out a way to bottle this and sell this, we could create an entire company. And it's so important because personally, I've suffered with acne my entire life. I've actually been on Accutane 3 separate times. And unfortunately, people say, oh, Accutane cures acne. It doesn't cure acne for everyone. And it can cause a lot of issues at the end of the day. There's a lot of side effects from it. So I believe everything that I push and sell to people, because the very first customer that ever was at Cortina was my wife. We actually went through 3 different iterations for the personalized medicine before we found the exact skin regimen that worked for her. Now she has absolutely perfect skin. She is our billboard when we go out and push. And that's the same promise that we give to every one of our patients in all 50 states. We will work with you throughout the entire process to make sure. And it's not just acne. We also deal with people that have rosacea, people that have hair thinning, if they want to strengthen their hair, if they want to attempt to grow their hair back. We have many different regimens for that, as well as hyperpigmentation or dark spots, aging spots, if you will.
Reid, I love the compound pharmacy angle, because this gives you a chance to really personalize to the exact needs of that patient. Now, having said that, I'm familiar with setting up compound pharmacies. I'm involved in one myself. It's very complex. How did you create the team around yourself to be able to pull all of this together? You're talking about telemedicine, you're talking about compound pharmacy, shipping, delivery, customer service, all that stuff. Tell me about creating that dream team.
Yeah. So I believe that the secret to any success is to surround yourself with people that are a lot smarter than you and know what they're doing. So as I'm a doctor, I'm also a technologist. I understand technology well. I'm neither at Cortina. At Cortina, I'm the CEO and founder. I hire the premier individuals to go forward with everything else. That includes my first hire, which was actually Paul Rusin. Paul Rusin is our chief technology officer. And you may say, that's interesting. Why did you do technology first? Because technology actually plays a major part of how we treat each of our patients. We have cutting edge technology that assists the doctor along the way. Paul Rusin has actually previously worked at IBM, one of the original architects of IBM's Watson AI machine. He actually created the first ever AI in healthcare solution. Paul came in full time with us. He hired our dream team of software engineers and data scientists. And so they went out 3 years ago to start building the technology that we now provide today to each of our patients. It's so seamless. The patient doesn't even realize that there's a quote, next generation technology when they're going through the process. As far as the compounding pharmacy, which is very important, we actually partnered. We partnered with one of the premier compounding pharmacies in the country that's called Curexa. Curexa is our third-party compound pharmacy. They've been doing this for more than 20 years. They work in all 50 states. They are the pharmacists out there. They are available literally 24 hours a day to any of our customers if they have medical pharmaceutical questions. Then our doctors. I went out as a physician myself, and I went out and recruited. I recruited hard. We got board certified dermatologists now in all 50 states. Our dermatologists are also available to our patients 24 hours a day. Our medical technology director, Dr. Michael Jacobs, U.S. board certified dermatologist. Why do I have a medical technology director besides also a medical director? Easy. We wanted someone focused strictly on the technology. He's been working with our technologists for 2 years to create the perfect solution for the patient at the end of the day and for the doctor. We want the doctors to be able to easily see and treat the patients. And that's why we're able to tell each of our patients, you will be seen and treated in under 24 hours. And then because Curexa is as good as they are, you'll receive your medications in less than 3 days. We'll make it on site and we will immediately ship it 2-day shipping directly to you because that's what people need. But Seth, you brought up a great point earlier. Hey, Doc, I got an issue. I just kind of send you a picture of it. One of the biggest problems with skincare is that, and for skin disease, there are not actual cures. Cures mean that if I take a medication for a while, it goes away completely. What we have for all types of, or for a lot of skin disease, are treatments. And as long as you continue to take your treatment, same way that if you get prescribed high blood pressure. If you get told you have high blood pressure, you're going to get prescribed a pink pill. You're going to take that pink pill really for the rest of your life for most people. And your hope is you don't get prescribed any more pills. When you go to your doctor, your blood pressure is, quote, completely normal. If you stop taking that pink pill, it would skyrocket right back up. In that same regard, you're going to be prescribed a treatment plan. You need to stay on that treatment plan, but you may have questions along the way. And unfortunately, you go to your dermatologist and I got another question for you, Doc. Majority of derms don't actually have the setup that your dermatologist has, where you can actually send in some photos and have those updated questions. So majority of people stop taking the medication because they don't know, is it actually working or not? At Cortina, you literally we proactively reach out to you every week for the first month to have you take additional photos to make sure that you are improving and to encourage you along the way. And guess what? If you're not improving the way the dermatologist thinks you should, we change your medication and ship it directly out to you.
You've talked about, you brought up the fact that getting, let's say, a traditional compounding pharmacy would probably be cost prohibitive because it's not covered by insurance. Cortina is so much more affordable. How did you pull that off?
We cut out the middleman. We go directly to the pharmacy. We go directly to the doctor. We go directly to the patient. Our goal was to provide access to every American in the United States. And to do that, we knew that a lot of patients just don't have insurance, or if they do have insurance and they think that their insurance even may cover telemedicine, it may cover telemedicine, but it may not cover teledermatology. So we did not want to prohibit any patients. That's why we do not require you to have any insurance at all. And it's a low $39.99 per month, gives you unlimited access to the doctor. So first and foremost, you're actually being seen by a board certified dermatologist that if you went into your local in-house dermatologist would probably cost you $40 copay, plus if you haven't met your deductible, another $100 to $200 extra dollars. That's just $40, but it also includes all the medications at the end of the day. So for $40 a month, $39.99, you get unlimited access to the doctor, plus your medication sent directly to your door.
That is absolutely incredible. And you've helped, over 100,000 patients. How has that impacted you and your mission?
So our dermatologists have, in their own practices and elsewhere, have seen over 100,000 patients. We actually just launched in May. It took 3 years to build the technology, to build the operations, to build the physician network of board certified dermatologists. Our goal is to see several hundred thousand patients, and we don't hire all dermatologists. We only hire dermatologists that have been around, that have seen the patients, and that's why we can brag that our dermatologists have together seen over 100,000 patients in their career thus far. What that really means for me is it's the law of large numbers. I personally, as a physician, could never, I'm not sure I could even see 25,000 patients if I had a long-standing career. But if I can create a company that can serve several hundred thousand, maybe even millions of patients in the United States, and then also our goal is to expand internationally. We want to be able to serve all people throughout the world. We're starting, of course, in the US of A, but our goal is international. If I can create a company that can do that, it's something that's so much bigger than myself. And it's something that's so much bigger than I could ever do, even working at an incredible institution like Harvard University and Boston Children's Hospital.
Hey, Reid, I have a question. I know you have your own site, your own marketing, you send people to that site. Have you entertained or had opportunities to leverage what you're doing on other maybe medical doctors' sites to allow them sort of an affiliate kind of relationship?
Yeah, that's a great question. There are a lot of different companies out there currently that are offering maybe wellness packages, or they're offering concierge internal medicine, right? So primary care that's virtual. What we built is difficult to build. And so we've actually had several groups come to us to say, can you be our dermatology arm? Can you provide the we provide the mental health. We provide the primary care. We don't have dermatologists, and to get them in all 50 states would be a gigantic lift. So we are actually currently in negotiations with several different concierge medicine wellness programs throughout the entire US to do exactly that. What we're also starting to offer is a B2B model, to where we're actually an employer benefit. So you may say, yeah, but you guys, everyone already has telemedicine, and they might. And, you know, with certain groups, they may include dermatology, but a lot of benefits actually don't include dermatology for free. It may be $90, maybe $100 per service, and that's just to be seen. That doesn't include the medication. So we are currently speaking with several different employer groups, as well as several different brokerage firms, to go out there and offer and allow us to enhance your current virtual care package to include dermatology. Because what a lot of people don't realize is 1 in 4 Americans have at least one skin disease that needs to be treated every year. That means at least 25% of your employees are suffering from a skin disease. And if it takes them up to 6 months to be seen in person, they're probably not actually being seen. The American Academy of Dermatology actually calculated out this. People say, oh, yeah, but acne doesn't really matter, right? Acne alone caused work production to lose over $1 billion in 2019 from either people missing work to go see a doctor, from the work having to pay for the medications, or from people just suffering from either pain or anxiety or depression from that and calling in sick. Because even, quote, even acne actually is an actual skin disease, and we want to be able to treat everyone.
Doc, you have so much going on and your time is so valuable. We greatly appreciate you spending some of it with us. We know you've got something very unique that's going on right now as we're recording this. Tell us what it is and how our viewers and listeners can learn more.
Well, what I'm so grateful for is that Kevin Harrington has actually partnered with us. Kevin certainly serves on our board of directors. Kevin, if you go to Instagram, Real Kevin Harrington, first and foremost, be sure to follow him, but also check out his link tree, because when you click on his link tree, you're going to actually see an exclusive. Because Kevin cares so much about all of his people and about everyone, he and I together have partnered, and we are giving away a full year subscription to Cortina for any skin disease issue that you have. A full year is $500 in value to Cortina alone. It is several thousands of dollars of value in the retail, quote, real world. So if you go to Kevin right now, guess what? There's no cost. All you have to do is enter your email address. You'll also be able to get updates on Cortina along the way, but just by entering your email address, you will be in a drawing. We are closing that drawing in literally before the end of this month. So as soon as you guys watch this, please go on and do that. I would be remiss to not say, also please find us at Get Cortina on Instagram, getcortina.com on the web as well, and follow along, because we provide constant education on skincare and on just good daily skin rituals.
Yeah.
All right.
I'm a customer also. I literally use the prescription that I got every single day. It's got a sunblock in it because my wife was always screaming at me that I wasn't putting enough sunblock on for golf and things. But Reid, thank you so much for a great session here.
Thank you.
I have one last thing.
I didn't want to say that because, HIPAA, right? We protect everyone's privacy. I never wanted to say that Kevin Harrington was a patient, but Kevin said it himself, and look at it.
I love the product. And one last thing, you did something called sheep tank. And because being a shark, I love hearing about sheep tanks. So if you just make that our last story here for the day.
I love it. Absolutely, Kevin. So, as adjunct faculty of plastic surgery, I also am a member of the American Society of Plastic Surgery. And plastic surgery is an innovative field of medicine, and we really want to encourage all of our members to continue that innovation. Of course, there's academic research grants, but also you need to create companies. It's creating companies that gets the real care back to the patients. So we actually at the American Society of Plastic Surgery have opened this new competition called Sheep Tank, to where any member can submit their business plan and their pitch deck, because we have hundreds of members that are full-time plastic surgeons. So they're also creating companies on the side because they've invented something incredible that's going to help patients. And so they get paired with a mentor. It just so happens I'm one of the mentors, and I'm not bragging on myself, I'm bragging on my team. Mm-hmm. Since inception 2 years ago, my team has won the Sheep Tank each year, and that is voted on by the members of the American Society of Plastic Surgery. They hear the pitches, and then they go in and vote, and then the winners get $10,000 cash to go toward that. No equity dilution or anything. It's a little different than Shark Tank there, right? But they go out to continue to build their dreams.
That's beautiful. Congratulations. Let's keep doing that, because that's it's a good way to empower entrepreneurs and get them excited about pitching and creating some great businesses. So
absolutely.
Thanks again. And Seth, I'll let you wrap it up.
All right. Thanks everybody for watching or listening. We will talk to you or see you next time.
Do you need money to fund your idea, product, or service? Are you ready to take your business to the next level but need capital to get it done? Kevin Harrington has heard more than 50,000 pitches and knows how to help you make the perfect pitch to get the funding for your entrepreneurial dream. He's distilled the process down in his perfect pitch cheat sheet, and it's yours for free. Just text PITCH to him right now at 727-888-2100. Text PITCH to 727-888-2100 right now and claim your free perfect pitch cheat sheet. Text PITCH to 727-888-2100 to start funding your dream today.
This show has been produced by Market Domination, LLC. To discover how you can have your own show completely done for you and turn it into a real published book and become the authority in your marketplace, go to www.marketdominationllc.com/podcast offer.